සැත්කම් සඳහා ස්ථාවර අවමගාස්තු දැන් නවලෝකෙන් අමතන්න 0771
Sri Lanka reported its 35th COVID-19 fatality last night. The 78-year-old man had died at home, while the cause of death is identified as a heart attack.
මෙතන තවමත් තියෙන්නේ සමාජ සම්ප්‍රේෂණයක් නෙවෙයි පොකුරු තත්ත්වයක්. හැබැයි සමාජ සංචකරණයේ ඉතාමත්ම අධික ස්ථානයකින් රෝගීන් විශාල ප්‍රමාණයක් හමු වෙනවනම් බොහොම පහසුවෙන් මෙය සමාජ සම්ප්‍රේෂණ තත්ත්වයට පත් වෙන්න පුළුවන්. ඉතින් ඒ නිසා තමයි අපි විශේෂයෙන්ම කොළඹ මහනගර සභා සීමාව තුළ අධික ජනගහනයක් වෙසෙන මහල් නිවාස සහිත ප්‍රදේශවලට සංචරණය තවමත් සීමා කළේ. ඒ ප්‍රදේශ හුදකලා කළේ ජනතාවගේ පැත්තෙන් සහයෝගය ලැබුණ නැත්නම් බොහොම ඉක්මනින්ම එය සමාජ සම්ප්‍රේෂණ තත්ත්වයකට පරිවර්තනය වීමේ අවදානම තියෙනවා.
A total of 15 COVID-19 deaths have been reported since the 1st of November in the island, with one death being reported every day since the start of the month, except on the 2nd of this month. In the meantime, 172 fresh COVID-19 infections were confirmed from the island today. A total of 510 COVID-19 patients were confirmed yesterday. The Department of Government Information stated that all of them were identified as contacts of persons who had visited the Paliagoda fish market. Out of yesterday's total figure, the Colombo district recorded the highest number of infections with 199, while the Gampaha district reported 183 COVID-19 cases. 12 COVID-19 cases were also identified from Kurunagala, 9 from Gaul, 4 from Kegol, 2 from Nuwara, 6 from Kalutara, 3 from Kandy, and 1 each was reported from the districts of Batiklo, Badulla, Ampara, Trincomalee and Monaragala. In addition, 72 COVID-19 infections were confirmed from the Valikara prison, while 1 was confirmed from the Kirulapana police station. 14 employees of the Colombo Municipal Council also tested positive for the virus. At present, 107 infections are confirmed among prison inmates. Out of them, 90 women and 10 men are from the Valikara prison, while the remaining 7 are from the old Bogambara prison. Meanwhile, at the request of the Minister of Justice, the Attorney General revised the instructions to the acting IGP to grant bail to suspects in remand and file charges as a measure to reduce overcrowding at prisons. In another development, Sri Lanka received a consignment of 100,000 rapid antigen test kits from the World Health Organization today. Since the first COVID-19 infection was confirmed from the island, a total of 14,101 infections have been reported thus far. Though the number of cases is rising by the day, so is the number of recoveries. 595 patients were given the all-clear to leave hospital today after recovering from the virus, placing the country's overall number of COVID-19 recoveries at 8,880. In the meantime, 5,186 persons are currently undergoing treatment. In another development, 89 employees at the Gurugoda apparel factory in Horana who were diagnosed with COVID-19 but weren't hospitalized until yesterday were directed to the special COVID-19 treatment center of the very factory in Kogala. Meanwhile, PCR test results that were conducted on the 5th and 6th of this month on the employees at the apparel factory in Gurugoda Horana were released today. It revealed that a further 38 employees at the factory had tested positive for the virus, taking the overall number of patients reported from there to 204. Elsewhere, close contacts of patients who were reported from the area of Kalutara, along with three-wheel drivers in the area and persons connected to the Colombo wholesale market, were PCR tested today. In the meantime, a total of 136 COVID-19 infected persons identified to be associated with the Paliagoda and Minuangoda COVID-19 clusters were taken to the Vatupitivala, Samanalawewa and Pinnavala hospitals by buses. These patients were identified as residents of Jayala, Siduwa, Vattala, Kalaniya, Mahara, Attanagalla and Gampaha. Meanwhile, a fishmonger who had sold fish purchased from the Paliagoda fish market in the area of Tilakapura in Ambalangoda was confirmed as a COVID-19 patient along with 7 of his family members. They were directed to hospitals in Hambantota and Kumbrupitiya. In other developments, 4 persons tested positive for the virus in the area of Kudavella in Tangol, following PCR tests conducted on 25 persons in the area. Among the patients are 2 children aged 8 and 14 of the same family. They had reportedly visited the home of a relative who had been to the Paliagoda fish market. Also, a person working for a boat repair company in Kudavella is also confirmed with the virus. He had recently returned from Negombo. Also among the infected is a 35-year-old woman who runs a beauty salon in the area of Mavella in Tangol. However, how she contracted the virus is yet to be ascertained. In another development, a beggar in the area of Anuradhapura who had been admitted to the Anuradhapura Teaching Hospital due to an illness was confirmed as a COVID-19 patient following PCR tests. The health authorities point that this COVID-19 infected person had roamed around in various areas in the sacred city of Anuradhapura for the past 20 days. Therefore, health authorities say that people in the areas where the mendicant had travelled to should undergo self-quarantine. Health authorities also took measures to direct 81 beggars in the city of Anuradhapura for quarantine.